If I record, I will
No, I'm
stop.
okay with that.
Okay, awesome. Thank you. All right. Good afternoon, everyone. My name is Danielle Angelari. I'm the Executive Director of NAMI Northern Illinois, which is an affiliate of the National Alliance on Mental Illness. And our mission is to really improve lives of individuals and families living with mental illness through support, education, advocacy, and hope. Just a few updates on our end before we get started today. We do have an art workshop coming up at the end of January. Our next Leading the Conversation webinar will be on the topic of anosognosia, which is that lack of insight into a more of a serious mental illness diagnosis. And then our next monthly meeting will be on caring for the caregiver, and I'd be happy to send just that schedule of events out to you all after this presentation today. But today we are going to be talking about depression. Depression is a complex mental health condition that affects millions of people worldwide. It's important to have a comprehensive understanding of depression in order to provide support and empathy to those who are experiencing it. Joining me today to speak on this topic is Kelly Finch, who's the Clinical Director of Family Counseling Services of Rockford. Founded in 1877, Family Counseling Services' mission is to foster stronger communities by providing individuals with accessible professional counseling and mental health care that empowers them to thrive. Kelly earned her bachelor's degree in psychology from Loras College in Dubuque, Iowa, and her master's of social work degree from the University of Illinois Champaign-Urbana. Before earning her master's, she worked for 8 years in a residential group home for abused and neglected youth ages 8 to 18, gaining experience and knowledge in working with trauma and child welfare services. She has over 26 years of clinical experience in working with trauma, anxiety, depression, bipolar disorder, ADHD, and other mental health conditions in a variety of settings, including Rockford Sexual Assault Counseling, Swedish American Center for Mental Health, Catholic Charities, and private practice. Kelly has been working for Family Counseling Services since July of 2022 as clinical director, where she has been working on training new employees and interns, as well as supervising the interns and staff. She loves helping to mentor new therapists in a time where we really need to have as many people working in the mental health field as possible. Just a few notes. If you do have questions, you can use the Q&A feature and you can just put them in there as they come, and I will help Kelly facilitate those. And if you're looking for continuing education units, I will be sending out an evaluation that does need to be returned to me as soon as possible. Kelly, thank you so much for doing this today. Turning it to
You're
you.
welcome. Hello, everybody, and I appreciate you being here today. So I just ask for a little bit of grace today because this is the first time I've done this. When I was during COVID, I know people were like using Zoom a lot, but that's not something I did a lot of. So this will be the first time I've done a presentation like this. So hopefully my technology will be okay and I will be able to give you guys all the information that will be helpful to you. Um, the slides prepared today, some of them might be pretty basic, but my hope is that um, I'll be able to kind of talk about my experiences as a therapist over the years and just guide you towards what I've learned and what my clients have taught me, what I've learned through my own life experiences about managing depression and um, the importance of getting help with it. And by the end of this presentation, I am really hoping that you'll have some new ideas on what to do with depression or ways to help other people with depression. So um, Danielle did kind of go over some of my life experiences. I just wanted to kind of let you know that through some of my own life experiences with like Rockford sexual assault, I understood how trauma affects a person's mental health and how unresolved trauma um, impacts a person's depression and anxiety. And that has been extremely helpful throughout my career. So, trauma informed care is really an important part of anybody's treatment. Um, when I worked at Swedish American, I understood that all types of depression doesn't look the same for everybody. Everybody's different, and we need to take it pretty serious when people are struggling with thinking about ending their life. And we need to kind of establish a place of unconditional acceptance and regard for people and try to help them get the support that they need. And working with the kids at schools, I also kind of learned about how kids are impacted by bullying in the schools and how that leads to depression as well, and how kids feel the stress of divorce and feel the stresses in their environments and what an impact that has on us as individuals. In working in private practice with a psychiatrist, I learned a lot about medication and the importance of how medication and therapy go hand in hand. And the studies show over and over when you you can get better through medication alone, and you can get better through therapy alone, but the two hand in hand are the most impactful in treating any kind of major depression or any other mental illness. So I know a little bit about medication and ways to kind of help people understand how it can be helpful to them, and when is it a good idea to kind of talk to your doctor or get a doctor. So if you guys have any questions about that, we can talk about that. In the 10 years of working in private practice on my own, I've worked with kids from ages all the way from 3 years old all the way up to 80 years old. So having some perspective on development and um, places in our life where our development gets impacted definitely impacts how we feel about ourselves and whether or not we feel a sense of accomplishment in life. And our sense of self is a huge part of what impacts our depression. Um, and right now I love mentoring and working with new minds and helping them to learn as much as they can about how to work with people in a non-judgmental way. Because if you're coming into therapy as a new person, you really need to feel safe that someone's not going to judge you, because depression is something that is insidious in our minds, and the negative thinking that goes along with it is sometimes very hard to manage. So I'm just gonna, most of you might know what depression is, but I thought I just put together a little video so I'm establishing kind of what the symptoms are of depression and a little bit of the treatment. So I'm just gonna play this for us for now.
Kelly, you might have to share your sound with us at the top of the
Okay, hold on.
screen.
So how do I share sound?
At the very top where it says like view options. Do you see that?
So there's mute, stop video, participants, chat, share, apps, more.
Like up by your camera, if you put your mouse up there,
Okay. Oh,
there's
okay.
do you see the share sound tab?
Choose video, background video settings. Oh, it's under sound,
Yes.
audio settings.
No.
Share screen.
It's gonna be up at the top of the screen.
Okay, I found it.
Okay.
All right. So you'll let me know if you can hear it?
Yes, I will.
Okay.
Of the world's population. But we
You're
as a
good.
society know little about it. Stereotypes tell us that depressed people are weak, unless they happen to be a tortured artist. It can be difficult to understand depression because it's invisible. It's a disorder defined by thoughts, behaviors, and feelings, rather than obvious symptoms like vomiting, rashes, or fever. Those who have experienced depression are all too
Sorry.
familiar with comments from misguided friends such as snap out of it or just get up and do something. Even those with depression might have a hard time understanding what they are experiencing, and they often blame themselves for not being able to snap out of it. To understand what depression really is, we need to talk about symptoms. First of all, depression has symptoms related to how someone feels. These symptoms include nearly constant feelings of sadness, anger, guilt, or hopelessness. Next, there are symptoms related to behavior. They include social withdrawal, a lack of energy, low motivation, poor concentration, sleep problems, or significant changes in appetite. Finally, symptoms related to thoughts include poor self-esteem, thoughts of suicide, and loss of interest in regular activities. Symptoms of depression must last at least 1 week, and they are often cyclical. This means that the symptoms can come and go over a period of months or years. A person who experiences depression once is likely to have future episodes. It can be difficult to think of these thoughts, feelings, and behaviors as symptoms. To many of us, because they are in our head, they can seem like decisions. It can seem like someone who is depressed has chosen to be lazy and sleep all day, or they have decided to stop spending time with friends because they have a bad attitude. But remember, what's in our head isn't imaginary. Our thoughts, feelings, and behaviors are influenced by a complex series of chemicals in our brains. The exact causes of depression are poorly understood, but we have an idea of factors that influence the illness. We know that changes to hormones in the brain, called neurotransmitters, can have a major effect on depression. Many medications used in the treatment of depression work by increasing the levels of these neurotransmitters. We also know that genetics play an important role in depression. People who have a family history of depression are more likely to experience the disorder. Just because your parents had depression doesn't mean you necessarily will, but the chances are greater. Finally, we know that environmental factors play a role in depression. Living in poverty, experiencing a traumatic event, or other stressful situations may trigger the disorder. That being said, depression does not always have a clear trigger, which often leads to a person not understanding why they feel so down. Treatment for depression usually includes psychotherapy and medication. Either can work on its own, but a combination of both medication and therapy has been found to be the most effective. In summary, depression is a disorder that's widespread but poorly understood. The symptoms can negatively affect a person's thoughts, feelings, and behavior to a debilitating degree. However, treatments that include medication, psychotherapy, or a combination of the two can help to manage to eliminate the symptoms of depression.
So go to the next slide. So I thought I'd just put together a few statistics for you. I thought were interesting. In 2021, NIH put together a survey, and generally, if your risk factors kind of include if you're female, you're more likely to suffer from depression than your male counterparts. This one said 10%. There were other studies I looked at that said 20% of the population of females suffers from depression and 10%. So this one's a little lower. But if you're between the ages of 18 and 25, you're more likely to suffer from depression than if you're older. Now, I also know that when people generally age into their 60s and 70s, the brain, isn't as effective in making those oops, sorry, hold on. Isn't as effective in making those that serotonin that we need in order to have the feel-good chemicals in our brain. And sometimes seniors often have a struggle, especially if they've had health problems. And anybody who's had any heart attack or heart surgeries is 85% likely to go through a major depression after a heart surgery. So that's a risk factor as well. If you're So if you're mixed race, you're more likely to suffer from depression than if you're Asian or Black. White people are more likely also to suffer from depression. Adolescents are more likely, to have well, females are more likely, and they're more likely to have severe depression between the ages of 16 and 17. And if they have two or more races. So, just to keep in mind that during these kinds of parts of our lives that there is sometimes factors that can affect us in just in general. We need to pay attention to some of our own risk factors in other things like stress. um, Stress is a huge risk factor as well. When your brain is inundated with the stress hormone cortisol, your brain actually, then the serotonin that your brain makes is actually gets depleted. So anybody who's under constant stress, um, changing schedules and work, going from a second shift to a third shift or first shift to second shift, when your schedules change back and forth and your sleep gets off, that's also another risk factor. Any health related problems, divorce, any kind of major life events. Number one top stressful event is the death of a child. Those parents are more likely, I think they have like an 80% chance of suffering from depression, as well as people having financial struggles. 14.5 million adults suffered from depression in 2021. But the good news was that 61% were receiving treatment and 74% received treatment if they had severe depression. I thought that was sounded like a hopeful number, because it seems like more and more people are seeing that getting help is a good idea for their depression. Um, on the flip side, adolescents are only 40% likely to get treatment, whereas they're only 44% likely to get help with severe depression. And teenage suicide is one of the number one ways children do die during adolescence. So we got to be mindful that's an area that we might need to, as a society, improve on in the next generation. So, common ways people cope, numbing out would be, most people try to handle it on their own in the beginning. And they just go through the day-to-days and keep trying to, you know, get through it. But then they find themselves using food at night or being on their phones too long or watching TV. And although that can help in the meantime de-stress, it doesn't help resolve the depression. Self-medicating with alcohol or drugs, especially if you're depressed and you're having sleep problems, people start using alcohol to go to sleep or start, seeking out medication to help relieve some of the pain that they're feeling. But that becomes, uh, a revolving circle, because alcohol causes, that is a depressant, and the impact of using drugs when your brain doesn't have them, it has more cravings for them. So you get in a bad cycle of guilt and shame in using these things. And it spirals the depression even more.
Hey Kelly, there's a question.
Okay.
It says, I can see why being mixed race might be stressful in the United States. Has there been any studies of race and depression in other countries that you know of?
I imagine there probably has, but I'm not aware of any right now. So, but I can probably look that up for you if you want me to an email, if you want to leave me an email address. Okay.
Yeah, we can do that.
Some countries, depending on the support systems in the country, I know that does have a huge impact on how people manage depression. We tend to be, our society itself tends to be isolative. We tend to move away from our family of origins. We tend to live in cities where you know uh, there's the populations are dense, and we are less likely to reach out support sometimes than other cultures. I do know that. So isolating is a huge factor in what makes depression worse, but it is the one thing that people feel the need for. I don't want to talk to anybody. I don't want to be around anybody. So I try to be very, very supportive in those situations, and family members can also be supportive in those situations by not trying to force social interaction. but to try to be understanding and encourage without forcing. um, but a lot of times people don't have the words. They don't know what to say. They just feel like their brains are on like pause. So I often keep in mind that a lack of being able to find the right words or say the right thing becomes the thing that causes people to want to just be away from everybody. And another one of the symptoms that causes that too is people stop feeling pleasure in those kinds of social interaction, because one of the symptoms of depression is a lack of pleasure in the things you normally found pleasure in before. So maybe you like going out to lunch with a friend, but if you're depressed and you feel like, sorry, my Siri's gonna, um, you don't enjoy it anymore and you just can't seem to get that feeling of enjoyment, then you end up feeling even more guilty because you should be enjoying this time with your friend and you're not. So then you end up pushing people away, and that often leads to kind of people not understanding or not reaching out. Um, Trying to wait it out by going through the motions. I call that white knuckling. You know, people will sometimes wait too long before they get help. And with if the environmental factors and the biological factors that are going on, and if you're not sleeping well, if you're isolating, if you're getting up and going to work and you're avoiding some of the things that you find hard time concentrating on and you're putting those off, and you feel like your boss is going to be mad at you, all that starts to build and build and build. So the sooner you catch it and the sooner you reach out and try to reduce any feelings of guilt about, letting somebody help you, the sooner you can start to get better. There is a lot of self-deprecating and shaming thoughts that go on with depression. Studies show over and over again that people with depression have a lot more negative thinking than people without depression. So in my work, when I work with this in the psychiatrist's office, um, I would notice that when people started medication in 3 to 4 weeks, the amount of negative thinking that was going on in their brain was significantly reduced. So I'd have often encouraged people just to kind of remember that, that the thoughts that you have are a symptom of depression. They don't have to be the truth about you. Even though if you feel bad and you're thinking these things about you and your underconfidence is there, that is a symptom. And to be mindful of that and to not always listen to what depression is saying. Denial or minimizing or justifying some of those self-medicating behaviors can lead to the need to, use more and crave more of those things. So it can set you up to kind of for a substance abuse problem. And, we try to be mindful of needing the treatment for substance abuse, and depression can often be, the comorbidity. People who are in substance, who get help for their substance use often kind of feel like they shouldn't, get medication because they're trying to get clean and sober. But if they've been using these drugs or alcohol, their brain is not going to be in a place where it can do what's best for them. So they need to help their brain get better as well as their body and their mind. Just a little kind of cartoon here. Where someone, it's just in your head, right? And you can just be positive. We've all been in situations where someone has said something maybe that's not been the best thing to say to somebody who's depressed. So I kind of thought this was funny when they this cartoon. Just a little bit of what we shouldn't be doing in life. And I wanted to show you this video of a man who was struggling with depression and kind of the steps that he took to get some help. So I'm going to play this for you now, and then we'll talk about getting help.
I didn't plan to take my own life, but I think it was fortunate that day I decided to take that route, stop the car in the field, and break down. If that didn't happen, I potentially wouldn't be here speaking to you. Hello, how are you? Things got tough a few years ago. I was leading a project that kept hitting barriers. The team was not collaborating, communication had broken down. I felt constantly under attack. Those 40 miles home felt like my only chance to shake it off. Then the cracks widened and started reaching into my personal life. I found myself in the midst of a separation. I couldn't see my children regularly. My closest friend for 30 years, I received the news that he died from cancer. It felt like a gut punch. I couldn't catch my breath for days, and I withdrew. In a professional environment, I was fine. I was talking normally, smiley, and everything else. As soon as I shut that door and I came back into my car at home, I was a different animal. I didn't talk about it. It was a cold night in early spring, and I remember it so clearly. My mind was racing. I couldn't sleep. I got in the car the next morning. Things were spiraling in my brain constantly. This was just mounting and mounting and mounting. It felt like a ticking bomb inside me. And I literally swerved across the road, parked the car in the field, and I cried. That was it. I completely broke down. I just needed to let loose. I just needed this to come out. I felt like a failure. Sorry. So it was tough. At that point in time, this is when I understood I need help. My decision to reach out that day changed everything. A colleague from work listened. He saw me and guided me towards a GP. I was diagnosed with depression and anxiety. They say that recognizing you need help is the biggest step. But realizing that I was not alone and reaching out, that's what saved me.
Oui, allô, comment tu vas?
I spoke to my family, my friends. I started understanding and explaining that this was a medical condition. And I began to see a way through. I dug really deep, questioning ideas I believed since my childhood. What it means to be a man, a modern man, and that it's okay to be vulnerable and for life not to be exactly how I expected it. 2 years on now, I know I can't erase my past, but it is the past, and I can leave it there. And today is about finding my happy right here, right now. And I am happy. I remember the surprise on my colleagues' faces when they heard what I'd been through. I started to realize that by opening up and being very honest about my story, my situation, some of them started opening up back to me. And I was able to talk to people who understood how I was feeling, who had gone through the same. And in my experience is not that people don't want to help. It's just we don't recognize the signs. So this is my story, my lesson. That there is strength in being raw and open and affected. And even on darker days, you're never alone. So break the cycle. Pay attention, reach out, open up. It's okay not to be okay.
I'm sorry, guys. Hold on. So I want to talk a little bit about getting help. I think that's the obstacle for people is that first thought about what do I do? What should I do? Where do I go? Who do I talk to? Um, People don't know. People who've never been in therapy before don't know how to pick a therapist. People who um, have been, they kind of know they're in a bad spot, um, might be feeling that it'll go away and they should stick it out. Um, but I do think there are some things that we can do as friends, as family members, as professionals to help people kind of not be afraid to seek out the help that they need. And the first step, I think, is just starting with your primary care or the nurse practitioner that you see when you go in for your physical. I love the fact that when I go, they ask me, are you having any, have you been feeling depressed or down? And they ask a few more questions about that, but they're starting to kind of screen for it more and more. And I think that's the first step in our world now. Primary care physicians can prescribe antidepressants. I think that that's a good first step. Oftentimes it can alleviate a lot of suffering. I would like to see more integrative care where mental health practitioners and primary care physicians collaborate a little bit more, and people get help. And I think there is good sense of the need to refer for therapy, and that people need somebody to talk to. But that can be the first step. And if you don't have a primary care, your insurance can help you find a doctor or a therapist in your network, and that's always important to stay within network because these kinds of things can get expensive, or to kind of find out in your in your um location, where do they have agencies that have a sliding fee scale, where do they have assistance for therapy. And that's what I love about family counseling, is that we try to help people in need that can't afford it. And we do have that capacity to use a sliding fee scale or take Medicaid. And that's often an obstacle for people who have Medicaid for insurance. They can only go certain places and not everybody takes Medicaid. So it's definitely something I think in our country, in every state, we could work on more to, as therapists, to become more cognizant of being able to help people that are not able, don't have those resources or opportunities, because everybody deserves to have somebody, a professional that can listen objectively and help them through serious mental health struggles. Um, the other, place that's a resource is asking close friends and family if they know someone that they've been to, or they know somebody that they, has gotten help before and has had good results. Sometimes that, just that person you're sitting across the table with, and taking that little bit of a risk to ask somebody, do you know of a good therapist in town? Or have you ever, do you know anybody that can help me find one? There's also things online. I find that, Health Grades is a website that has all the doctors and therapists that are listed. Sometimes there are reviews, and sometimes you can Google the therapist and look up their own website or reviews that are online. Um, I think the websites for practitioners and doctors are great to check out, because we have to we have to find a way to present ourselves online so that if you get a snapshot of who we are and you feel like that might be a good fit, then we've done a pretty good job of being authentic and putting ourselves out there to say, hey, this is who I am, this is what I like to do. And if you don't feel that connection right away, keep looking, because I think that people tend to be drawn towards somebody and their expertise based on what they're feeling is a lack of a need not getting met inside themselves. And Psychology Today is great for finding therapists and doctors in your area. A lot of therapists and doctors can post their bio on Psychology Today, and you can look up doctors and therapists on that website. Does anybody have any questions about how to maybe get help? I'll just give you a few minutes if you do. Okay. All right. So when you do finally get help, hopefully that help is not like this one. So, being able to meet you where you're at in your struggle with depression is an important part of the process of getting better. Um, Trying to push people in to do types of interventions that the person is not ready for or not capable of is not helpful in treating depression. And if you as therapists, we need to be mindful, in kind of making suggestions and giving advice about like exercise and eating right. As people, it feels overwhelming at first, and I feel like the first step in getting help is establishing that rapport and trust and a safe place to go, where if they're coming in and they're crying every week and you're there for them and they feel seen and they feel heard, that is the very first step in getting better with depression. So what to expect from therapy? If you do end up kind of initiating therapy for depression, definitely try to look for someone who's client-centered, who respects the pace that you can go at, and doesn't have their own agenda or doesn't talk about themselves the whole entire time. Um, they can help you tackle problems, you know, as you're ready to. I mean, if you can't get out of bed every day, um, and you're spending long periods of time at home and can't work, that is a symptom. Um, Instead of what you should do, which will create more and more guilt, we can work on what can you do and what will help reduce some of those symptoms. It's very, very important in the beginning that you pick things. Anybody who's depressed picks activities or anything that they want to start doing, they have a 75% chance or greater of creating some type of pleasure in that activity without any guilt. As therapists, we need to be consistent, safe, and trustworthy. That means we need to respect confidentiality, be empathetic, and be emotionally available. We should target interventions that are meaningful to the client. A lot of us have our own kind of way of working. We have our own training, and we have different things that we think are effective, but what's effective for one person isn't necessarily going to be effective for another person. I've seen people drop out of therapy when we overemphasize exercise, and that's the last thing a client feels capable of doing. I've got a question. Well, support groups. I think support groups are great. Um, and if a person can't get themselves out of the house, there are lots of support groups online now too that you can access. I meant to type those up in my presentation today. Uh, we do have a brochure here at Family Counseling that we did look up some websites that we utilize in order to give people things that they can do if they can't get in right away. I forgot to grab that before I started, so let me think about those. But support groups are very helpful to people, because when you feel like you're not the only one and and you're developing that support system, that reduces the isolation. It reduces the impact of that negative thinking in your brain. If you know someone else is thinking the same way you're thinking, you know it's not you, and you know it's depression. Okay. Hang on, what happened here? All right. We should try and help clients build support systems that are helpful. Once again, support groups, but family members. It may involve, trying to have your client bring in a spouse or another family member and educating them on how to be a positive support, reducing pressure that's not helpful, or saying, things not to say in a situation. Um, and how to be a good listener is often something that can be very helpful to family members and friends or spouses. Um, I do believe that I have seen, and this happens a lot of the time with anybody dealing with chronic depression. Spouses often get frustrated and have their own feelings about that because they've picked up a lot of the slack. They're doing more with the kids, or they're doing more of the housework, and they start to get angry. And that anger then spills over into the guilt that the person with depression feels. And so them coming in together and working on that, and hopefully, working towards progress that's realistic, and kind of taking some of the pressure, or getting help for the spouse who's frustrated, and having them have someone that they can listen to so they're not dumping on the person with depression, is important. I really believe developing realistic goals when a person has major depression or chronic depression is really important part of treatment, an important part of the process of therapy. But realistic expectations, people with depression often expect themselves to function the same way that they do when they're not depressed. And that is not realistic. If you do not have the energy to do laundry every day, you are not going to do laundry every day. But if you start beating yourself up for not doing the laundry, or not keeping up with cooking, or not being able to spend time with your kids or play with your kids, all those just heap on the guilt. And guilt is like gasoline to the depression fire. Depression loves guilt. It will make it, it will just glom onto that and make a person feel worse. So, kind of helping people understand that depression has a way of creating more and more guilt itself. But then as you go, if you can develop realistic expectations. So, if you can't take a shower every day, that's okay. How often do you think you can take a shower? You know, and setting it up like, well, can you start to think about what it would feel like if you did take a shower, and what you would get out of taking a shower? Does it have that 75% chance of making you feel better if you do? Um, and when I've worked with people who just starting treatment, and they've been diagnosed with major depression, I often kind of start out with, what are 3 easy things you can do in one day? If you can think of 3 things you can do in the day that you're in, and just do those 3 things, and everything on top of that is, like icing on the cake, is that's the positive. In as long as you're accomplishing those 3 things, you get to feel good about yourself. And so we'll pick 3 things that are easy enough together. There's another question here. Can past or present traumas exacerbate the symptoms of depression? Would you recommend DBT therapy program, or rather a CBT program for trauma therapy? Absolutely, trauma does impact depression, and past history of physical abuse, sexual assault, domestic violence, physical abuse, emotional abuse, all those make depression worse. And all those underlying feelings of trauma that have been stored. I'm going to talk about that a little bit on the next slide. So I'm going to come back to different types of therapy and trauma. When you do have trauma that you want to work on, you definitely want to work with a trauma-informed therapist. Most therapists are trauma-informed in their career, but some specialize in it more than others, because they found that that's their niche, or they've had the experience. Like I have been working with Rockford Sexual Assault was my first job, And ever since then, I have always loved working in that field. So my education and training throughout my career has focused on learning more and more about that. So that's something you can always ask a therapist before you even set up an appointment. But I'll go more over the DBT and CBT next in the next slide. Let's see here. Okay, in therapy, we should be consistently assessing for client safety. Have you had any suicidal thoughts or feelings? Are they worse or better? People who have major depression, that is a symptom. I work with them and teach them that's a symptom. It doesn't mean that that's something, um, most people actually don't want to do that. They don't want to leave this world, but they want the pain to stop. And I try to validate that the pain and the suffering is hard and that you do want it to stop. And that just by telling on it and telling someone else that you feel that way or you think that way often reduces the urge or the crave to do that. And it's hard if someone in families, when someone has made a suicide attempt, the family members are scared, especially with adolescents. They put a lot of pressure on the adolescent to get better, and to not feel that way, which would, to be scared. So they constantly ask the kids if they're, feeling that way. And then the kids feel more pressure. And so I try to give the parents permission to let me as a therapist, you know, ask their child about that. But I also encourage the kids to make sure if you are feeling that way or thinking that way, you tell on it right away because it reduces the shame, it reduces the guilt, it takes away the intensity, and it makes it more likely that they'll stay safe and they'll get more help. And generally, we are available for crisis calls if kids are feeling worse or adults are feeling worse. And also therapists need to be willing to explore deeper issues they may be impacting depression. And that means, that we don't stay on the surface all of the time, that once the symptoms have been alleviated, one way of managing depression or making depression better is to resolve things like grief or trauma or loss or abandonment. And those issues have to be gotten at. We can't just stay on the surface, but we have to be mindful not to go too fast and too far into difficult emotions because that could be triggering or could create more depression. All right, types of treatment. CBT. What is cognitive behavioral therapy? Okay, people with depression, most therapists, I say this because most therapists have been trained in this, and I call it the bread and butter of therapy. We feel things because we think things, and the fact that we are constantly evaluating our own behavior, we're evaluating who we are, we're trying to be the best version of ourselves and feeling like we're falling short, our fears of failure, our fears of success, or our unrealistic expectations of self, all those things that go into feeling crappy about yourself have a lot of negative feelings attached to them, a lot of negative distortions. And part of what cognitive behavioral therapy does is tries to help clients identify those cognitive distortions. And those distortions are things like, they call it all or nothing thinking, when you think like things are never going to get better, or I'm always going to be a disappointment, or you over focus on, they call it mental filter, you over focus on your negative traits and ignore your positive traits. You are in depression, anxiety can go hand in hand, or you're constantly fortune telling and doing what if thinking, what if this happens or what if that happens, and it's always a negative outcome. Or people are thinking negative, assuming that people are thinking negatively, or taking things personal, blaming yourself for everything, or labeling and calling yourself names, or shoulding yourself. All those are part of shoulding, like I should have done this or I should have done that. That focuses on the past and things you have no control over. So CBT helps to identify all those negative patterns in your thought and ways to transform those into different types of thinking that you'll actually buy into. Okay. Cognitive behavioral therapy is not always about changing a negative thought to a positive one. It's really about finding a way not to believe the things that are not true and to try to find the ones that are true, the rational thoughts and the ones that are realistic. And to develop a sense of reframing sometimes negative events or negative experiences and not seeing that, it has a negative meaning about who you are. But there are kind of lessons in life that we have or experiences that are not our fault. Then there's DBT therapy. If you have never heard of DBT therapy, it's called dialectical behavior therapy. And what it involves is four main areas of skill building. And those four main areas, the first one is mindfulness, where you work on being more present centered. Okay. You try to work on catching your brain when it's going to the future, your what if thinking, or into the past, into the should thinking, and trying to get it to stay in the present and focus on what is happening to me right now. And can I objectively look at these thoughts and try to understand them and not judge them? What are they trying to teach me about me in the moment that I'm having this thought? And what is it teaching me about what I need? So that's mindfulness. And then there's distress tolerance, is that when you do get in a state of distress, like and your feelings are intense and they feel out of control, there's skill building in how to manage the distress and how to tolerate it as you're working through things like trauma, or you're working through things like a divorce or grief or anything. And dialectical behavior therapy was originally developed to help people who really were struggling with borderline personality disorder, but we are using it more and more as therapists throughout, as a part of skill building in therapy. And it's not for just one particular diagnosis. They're just really helpful skills. So distress tolerance helps to try to bring an intense emotion down into into a more tolerable emotion. And it could involve things like changes in temperature, like using cold on your face or warm, um, developing kind of a list of distractions that will make you feel better. But there's a lot more to that. So I'm not going to go into all those things because there's a lot of skill building in this. The other one is emotional regulation, and that's being able to just identify emotions, be able to understand your emotions, and then to be able to regulate them up and down. Can I tolerate my grief a little bit more as I talk about it? Or can I uh take this emotion of because anger is a big part of depression too. Sometimes people feel more angry than they do sad, and they're irritable all the time. So, in trying to understand that feeling of anger and how to regulate that anger and to use it instead of being destructive, how do I can use it to be constructive? And the last one is interpersonal skills, social skills. And that's teaching people how to then use like things like assertiveness or conflict resolution skills, so that in their treatment, that instead of pushing people away, they're helping to communicate more effectively with people so they're feeling understood and able to set boundaries. The next one, I have quite a few here, so I'm going to try to go through them. Oh, we're almost out of time. Shoot. Okay, mindfulness, I already said. Insight orientated therapy and trauma focused therapy is really important if you have any type of past sexual abuse or physical abuse, or just a very chaotic childhood growing up. And working through those traumas gradually with someone you trust is so important for recovery. Polyvagal theory is new theory born out of our understanding of how the body holds on to our memories and the difficult feelings that we have. So it is based on understanding the parasympathetic system and the calm state, and the sympathetic system, the stress state, and fight, flight, or freeze. So more and more therapists are learning about how to use and understand when our brains go into the danger zone and how to bring our brains back online, and to be able to understand how to regulate emotion. So if a therapist knows that and uses that, they're working with your body and your mind at the same time. Internal family systems is understanding that we have different parts of self, and that those parts are not to, we don't judge those parts. We have parts that are that have developed out of a sense or a need to protect us from things and difficult emotions that we can't handle at the time that they occurred. So it's really an interesting, and I've started to use this more and more and learned this recently, but this is kind of a newer type of therapy, and some therapists know it, some don't, but it helps you to kind of identify parts of yourself that sabotage you and kind of set you up for failure. And you kind of, when you're going, I don't know why I just did that. Why do I keep doing that? Internal family systems can help you kind of identify what that part needs, what it's doing, and how it's trying to protect you without judging you, and then understand that the burden that it carries is actually making it harder for you, and that kind of was born, that part was born maybe out of a childhood part, or a need to manage the system so that you don't feel a sense of failure. But this is a new and interesting way of also kind of getting at deeper issues, and also working with all of who you are, and becoming more of an authentic self. EMDR is something I've been trained in recently, and wish I would have, done the training much sooner in my career. I feel like it's along with the trauma focused therapy and just insight orientated therapy, EMDR helps us process traumatic events by making, like, anything that you still remember and you still have the same feelings about, the negative feelings that you did when it occurred. It could be a car accident. It could be a moment where where you were sexually abused. It could have been a time when uh well, anything traumatic. EMDR helps your brain take that event, and since it gets stored in the more primitive part of our brain, in the, I call it kind of like the trauma center. We have a protective part of our brain that keeps those emotions and those memories stored away till we can handle them. And usually that's later on in our life, and that is one of the reasons why people get depressed, because all of a sudden all this stuff starts coming up. EMDR, along with really good, individual therapy, can help you process an event from beginning, middle to an end. And once you have the ending, when you think about that event, it no longer evokes the same intense emotion. So that's the goal of EMDR. Nutrition and exercise have become a very important part of depression management. There are so many chemicals in our world, in processed foods. The more ingredients on a label, the more those chemicals are affecting your brain. And the studies are starting to show over and over that highly processed foods are contributing to our mental health problems, both depression and anxiety. So, if we can work at trying to develop healthier kind of diets in our world when we have depression, and trying to keep it simple by incorporating more fruits and vegetables, and trying to find easy ways to make foods, or even get food when you're out, where to go, where you can make healthier choices versus the fast food places that put a lot of, chemicals in their foods. We can get those new nutrition facts from any fast food place. We don't have to cut everything out, but we should just be more aware of how that impacts our brain, and understanding that's an important part of therapy, and also it can be just an important part of your own journey. It's spelled exercise. Exercise is the number one way to make depression better, but it's often the most difficult. But when you do incorporate exercise and movement, you create positive chemicals in the brain, and it definitely can help relieve and alleviate depression. And then medication management, finding a doctor that will work with you on symptom management and reduce and hopefully avoid like significant side effects. If your doctor is not listening to you about the side effects that you're experiencing, and the side effects outweigh the benefits, then it's time to kind of rethink, where you're at with medication and try to talk to your doctor and try to make sure that you are that you're getting some benefit and that you're reducing any kind of side effect that might come from the medication. There's also TMS, and that's it's a form of they use magnets and they hook them up to your brain to stimulate the parts of your brain that can increase the serotonin in your synapses to improve your depression. There's studies. This is newer, so I'm not sure what the effectiveness of, but for chronic depression, that can be a non-invasive way of getting some help. And then we also have, we have newer medication, ketamine, and then psilocybin. That's not um, approved in Illinois yet, but I do believe that they are trying to approve that. Now, for chronic depression that's been around, looking at alternative forms of therapy that might involve these things and being informed and working with your doctor and your therapist and not just relying on one thing become an important part of recovery. I have a couple questions, and then I think are there free resources for therapy in our community for trauma therapy? Um, Free resource. Okay, so Rockford Sexual Assault, they have the first 10 sessions are free, and that's for not just sexual assault, but that's also for sexual abuse. If you have childhood sexual abuse, or that we try to work with people on what they can and can't afford. I don't know of any other free resources. Um, um, the group there, I don't know of any self-help groups, but sometimes churches do. Okay, Trauma Recovery Center, free therapy service for victims of crime. Kira, do you know where that is located? NAMI has support groups that meet multiple times per week for individuals and also groups for family members and parents that meet throughout the month. So check out NAMI. Yeah, I'm sorry, NAMI, I forgot to kind of mention you. Definitely, NAMI is a great resource. And sometimes you can look online too to find other groups that are in town. Okay. All right. We're almost out of time here. I just want to kind of point out that the process of getting better takes time. It's not linear. Usually you start to have one good day or maybe 2 good days a week and maybe 3 or 4 bad days. And then you have 2 or 3 good days and then maybe 5 bad days. Then you have 4 good days and 3 bad days. So it generally goes in that kind of process. You don't go from starting the medication in 3 weeks, you're all better. You get better gradually, and there are often setbacks. So expect setbacks. You should always focus on safety at first and improving your sleep and function. Sleep is a #1 contributor to depression. Also, I wanted to point out too, there are also nutritional deficiencies that cause depression. If your B12 is significantly low, that causes depression. If your vitamin D level is significantly low, that causes depression. If your thyroid is off, that causes depression. If your blood sugars are all over the place and they're jumping all over the place, that causes depression. So make sure you look at your health issues as well and talk to your doctor if you feel like you'll have any of those issues, or ask them to check for those when they do your blood work. Goals should always be small and achievable. And we should always focus on improving and repairing any personal relationships that have been affected or impacted, because we want to people need to feel supported. They need to feel like they're connected and they can be close to people as they're getting better. Connection is the #1 thing that helps us all as human beings get better. Learning to detach from depression symptoms is a really important part of recovery. Seeing them as symptoms that we have, like a medical problem, like he said in the video. They're not who we are. They're something that we have, and they will get better. Most people do not stay depressed their whole lives. They do get better. Finding ways to reduce negative self-talk and focus on accomplishment, what you did do instead of what you didn't do. Learning the skills that we talked about to manage and reduce anxiety and communicate more effectively, in resolving past traumas. So last one, I got here, just real quick. Maintaining progress, have things in life to look forward to, planning a vacation, going, spending a weekend with a friend who lives in another city, build skills for closeness in relationships, turn off the TV, go for a walk, talk to each other while you're driving in the car. All those can be helpful. Take those opportunities to ask or check in. How are you really doing? Is a good question to ask your loved one. Work on building your self-esteem through self-acceptance. We are all faulty. When we accept our faults and we focus on our strengths, we do a whole lot better in managing depression. We work on resolving griefs. Don't run away from them. Realize it's an important part of who you are, and your pain is important, and resolving those things. You deserve not to suffer for the rest of your life. And the most important thing to keep depression away is to be kind to yourself and realize that you're worth taking care of. Educate yourself on food. The food you put into your body affects your mental health. Make small steps that way. Try not to rely on, quick and easy fixes. Those don't work. Changing your diet to a healthy lifestyle is much more better than being on a diet or completely cutting out sugar. Who can do that when you're depressed, right? I would never be able to cut out my chocolate cravings. Practice mindfulness and use the skills you learned in therapy. All right, I went over and I apologize for that. Is there any more questions? There's another resource at OSF, Strive, TRC at St. Anthony Medical Center is another resource that Kira gave us. Thank you everybody for being here today. I really appreciate your time and I hope that it was helpful.
Yes, Kelly, thank you so much for all that awesome information. We appreciate
Okay.
you a lot.
All right.
I
Thank
hope
you, Danielle.
everyone has a good day. And remember, if you're looking for the CEUs, I will follow up with an evaluation to fill out. And thank you.
Thank you. Bye, everybody.